They are expecting as many as 55,000 to 110,000 hospital beds will be needed. As many as 18,000 to 37,000 ICU beds.
Governor Cuomo can only look toward Italy, South Korea, and China to know what lies ahead when COVID-19 reaches its peak in New York State. And for a state that only has 53,000 hospital beds, he's trying to get the rooms and equipment now, before the healthcare system crashes.
I'm not sure how many ventilators we do have in New York State, but I know that there are others that the federal government has stockpiled somewhere, and if we have to, then they're going to have to release them.
President Trump, at a press conference today, acknowledged New York has a pretty big problem and said he'd had a very good talk with Governor Cuomo. That's the good news. Mayor de Blasio asked New Yorkers with common cold symptoms to stay out of emergency rooms and said when the virus hits its peak, we may be seeing dormitory-style hospitals pop up, similar to what we saw with the 1918 flu pandemic.
In terms of the sheer reach of this disease, the only parallel will be the 1918 influenza epidemic.
We're at North Central Bronx Hospital, and this is just one of the city facilities where new intensive care unit beds will be created to accommodate the surge in patients that are expected to be seeking care for the COVID-19 virus. Mayor de Blasio said he's also seeking to mobilize 9,000 retired healthcare workers who make up a medical reserve corps to assist with the crisis. Meantime, in Washington, the director of the National Institute of Health appealed to millennials once again to stay close to home and stop the spread, which is impacting older Americans the most.
When we're asking the young people to help us with this mitigation strategy, by staying out of the bars, staying out of the restaurants, you don't want to put your loved ones at risk.
I'm Mary Murphy, Pix 11 News.